All right, welcome back. Again, Andrew Gorecki, Doctor of Physical Therapy, here helping you eliminate your back pain naturally without medications, injections, and surgery. And again, that's the topic of this module is three most common things that are given for back pain patients fall in the category of medications, injections, and surgeries. And if you remember earlier, hopefully you do, we talked about the 3 ways to handle a problem. And remember, altering the problem is the most common. Well, these 3 categories fall into that category of altering back pain. And you might be thinking, well, I never really thought of it that way. And that's the problem. That's why we're doing this course. That's why I'm highlighting this issue right now, even surgery. So example, my surgery where I I had a disc bulge removed from my spine, that only took away the disc bulge, but it didn't fix the reason that was causing the disc bulge. That's why 2 weeks after my disc bulge was removed, it came back in the same location, and I was told I needed another surgery. It's also the reason why people 2 years after back surgery, more than 50% of people are still in pain. That's what most of the studies are showing. And the reason is because the thing that was causing the stress on the back in the area to cause damage, which causes inflammation, is still there. And so what ends up happening with a spinal fusion, for example, is you fuse one segment to stop the motion from causing stress and damage and inflammation and pain to the nerve. But then as time goes on, the segment above and below starts to move too much because it's a movement problem. And so that's, again, why the surgeries only alter the situation. So let's talk about in detail kind of these 3 things. So let's start with injections. So again, injections, studies show that less than 50% of the time does it help somebody in the short period of time, in the short term, and there's no evidence to support long-term relief or solutions from injections. In fact, it's not just my opinion, but in 2015, the review of the medical literature, the Agency for Healthcare Research and Quality found no evidence that epidural steroid injections were effective in treating symptoms of spinal stenosis or typical low back pain. So they were not effective in treating the symptoms, not only in this case in the short term, but also in the long term. Yet, almost everybody I meet that has back pain for a long period of time ends up getting prescribed or getting told they need to do injections. In this case, even in the presence of a recent disc herniation and the sciatica that comes along with that, like I had, and many of you do, listening, the benefits of injections were small and not sustained over time. So again, essentially, those are severe back pain, herniations with sciatica. That's a severe type of back pain. But even in those cases, the benefits were very short-term and small. That news followed on the heels of an FDA statement, so the Food and Drug Administration recent statement, warning that injections of the active medication in these shots, which are glucocorticoids, steroid injections, a class of corticosteroids, into the epidural space of the spine, which is where all injections go for pain relief, could result in rare but serious neurological problems, including loss of vision, stroke, paralysis, and death. So based on those and other findings, the Journal of the American Medical Association advised physicians to refrain from recommending injection therapy to patients with any kind of chronic back pain. So right there, that says it. The Journal of the American Medical Association is recommending against it, yet we're still doing it. It's one of the most common treatments. Why is that? Well, it's how some doctors make money. Let's just be honest. We live in a fee-for-service healthcare system. Now, again, I'm not against finding short-term pain relief, but so go ahead and do the injection. You need to know the risks, so now you know the risks. You also know that the outcomes aren't very good for long-term relief, but also if you feel like you need to do it, it's fine. Do it in conjunction with trying to find the reason that's actually causing back pain in the first place, which we're going to get to in this course. Now, again, medications is by far the most common treatment given to people, and it falls in that category of altering the problem. We have pain medicines, right? So we know that pain medicines, there's a big long list of opioid pain medicine. There's also non-opioid pain medicine, but in this case, opioid pain medicine We now know that 2/3 of people that have accidental overdoses from opioids started because they had a movement-related problem, pain problem. So they had a musculoskeletal problem, and number one is back pain. This year alone, 70,000 people are predicted to overdose accidentally from pain medicine because you need to take more of it as time goes on because it becomes less effective if you take it and that's all you do because you're not fixing the source of the problem. That's over 200 people a day. Not effective. Pain medicine does not fix back pain. In fact, pain medicine masks back pain, and we know that, remember the gradual onset cumulative trauma problem? It's actually going to get worse over time if you just ignore it. You don't fix it. You're just getting pain medicined up. I've been there and done that. It's not a good path to go down. Number 2 type of medication are anti-inflammatories. We talked about that earlier, but again, they only mask the symptom of pain and they can actually delay the healing process because inflammation is required for our body to progress to the healing phases naturally. It's why when you do have surgery, if you do have surgery, I hope you don't have to have surgery. I hope that you don't have those red flag symptoms that would require surgery because we know that without those red flags earlier that I talked about, surgery is not beneficial. We know that now surgeons, this is fairly new, but after a surgery, you're not allowed to take anti-inflammatories for 6 to 8 weeks. Why? Because it delays the surgery from healing. Nerve medications. We take nerve medications to block the conduction velocity of the nerve so it makes your brain feel less pain. It also makes you feel tired and kind of loopy. And then finally, surgery. So surgery right now in the country, even the best spine surgeon has a 50% success rate according to surgery research. And we need better outcomes than that to be able to do the high-risk procedure that is surgery. And this is specifically spinal fusions, but disc herniation and bulges aren't that much better. But again, why is that? It's not that the surgery goes wrong. So the surgeon fuses the spine and everything is fused, but it's the areas above and below that now have to move more. And the problem hasn't been fixed, so those areas will get damaged and start to cause new pain. And if you have a disc bulge or herniation, again, you're just removing the area that's bulged and you haven't addressed the thing that actually caused the bulge to happen in the first place. And if you have SI pain and they did a SI fusion, it's the same thing. They've fused one spot and now they make the other parts move more and you're going to have new pain very shortly. So hopefully that helps address that we really don't want to do medications, injections, and surgery. We need to, and all literature is pointing towards movement, exercise, prescriptive movement, addressing your dysfunction that's causing the back pain is your best option. We're going to get into that as we move forward, so bear with me.